Just a little bit about Andy. I believe this is the third or fourth, I think it's the fourth seminar that we've had Andrew down from Haynes Benefits and Lee Summit to come and speak with this group, and we really value and appreciate the guidance that Haynes Benefits gives us in our agency so that we can turn around and help educate you, our clients and partners in the community, and ultimately, as we navigate healthcare reform, we're 5 years into it. I think we can all agree that it's been a very interesting 5 years. So the more information that we can give you, the more that you can see it, ultimately the better and the easier it is to understand. So this morning, Andy is going to cover some of the old, some of the new, a little bit of getting into the weeds. There'll be an opportunity for some questions at the end. I encourage you to write those down as we go throughout. I mentioned there is a break. We'll break for 20 minutes at 9:40, but I want to encourage you, if you need to get up and use the restrooms, feel free to do so. With that, just a little bit about Andy. Andy is the managing partner of Haynes Benefits. I mentioned at a Lee Summit. He has been focused on solely employee benefits since starting his firm roughly 12 years ago, and most notably the last 5 years, his job has been nothing but healthcare reform. So when we think about how old healthcare reform is, or ACA, or PPACA, March 23rd, 2010, we're right at that 5-year date. So his whole focus has been on interpreting the law, staying on top of it, and ultimately providing that guidance to his clients. So we're thrilled to have Andy come down. Andy's also the author of two books in regards to HIPAA and all things but HIPAA as it relates to employee benefits. And also, Andy's a prominent speaker in the Employee Benefits Institute. Have him come through. I know he's got a very busy schedule. And with that, I ask that you please just help me welcome Mr. Haynes.
Well, thanks. Wow, that's pretty loud. It's good to be here today. And can we get the slides up? Got it. All right. Thanks for the introduction, Tom. It's good to be back with y'all. I've been down here enough times now that I'm recognizing a whole bunch of faces in the room. I will apologize for one thing right off the bat. I'm sure this is affecting none of you, but my allergies are going berserk. So my voice is a little different today. It's a little weaker today. Wednesday I had no voice, so I was a little bit concerned about even getting down here to do it at all. But it's great to be here. We have a very, very packed list of items we're going to talk about today. I've called this 2015 the next trailhead, and 2015 is a key, crucial year under the ACA. The ACA has been amazing in terms of what it's done to me personally and our firm. It is the most significant piece of legislation and benefits since 1974. In 1974, ERISA was passed. I was not practicing then, but I have friends who were, who told me what life was like in 74 when Congress completely overturned most of what was going on in benefits. That's kind of where we are today too. So we're going to talk about a whole, as we've marched through or hiked through a series of dates under the ACA. A lot of things have kicked in this year and are going to create a great deal of angst this year. Originally, I thought 2014 would be the biggest year under the ACA because that's the year that pay-or-play was supposed to kick in, some other very key items that we're going to talk about. But through delays and transition relief, a lot of that has come to this year. As we, in my firm, as we were dealing in the last quarter of 14, and it was extremely hectic, everybody's kind of wearing out and getting stressed out, and I said, yeah, it's all right. This is just warm up for 15. The fourth quarter of 15 is just going to be nasty. There's no way around it. So we're going to talk about all those things that are going to affect all this. Here are the topics that we're going to hit through the morning. We're going to start off with 2014 market rules. I will go through these really fast. I taught these last year to you all, and most of you are here then, but this will be a little bit of a refresher course. Marker 2 will be cafeteria plans and premium payment arrangements. There's been a great deal of guidance here, and even though we've had massive amounts of guidance, we are still seeing a number of employers and advisors who don't get it, who are doing these things wrong. And I don't want you all doing these things wrong, so we'll go through that. Marker 3 will be pay or play. I'll tell you right now, I am not doing a complete overview of pay or play. I've done that the last couple of years here. I'm going to go over what the new changes are for this year, and some of them are very critical. Just to tell you why I'm not doing a complete overview, I did one last week out in Portland and had devoted 4 hours just to pay or play, and we ran out of time. There's so much there, but I'm going to talk about what the big issues are for 15. After that, you'll need a break, so we'll talk about sex. And I'll just leave it up to you to figure out what that topic's going to be. Marker 5 will be wellness. A lot of new changes under wellness, and there are a lot of employers are wanting to get more involved in wellness. Certainly the carriers have caught on. The ACA had some good stuff in it with regard to wellness. So we'll talk about where that is this year and what some of the changes have been. And then finally, when I was talking to Tom, and we talked several times about what Connell wanted me to talk about today, and I said, well, for one thing, if I can just do updates on pay or play, that gives me a good gap of time. And one thing that I haven't gone over with you all in great detail, I've touched on it in past years, but haven't gone over in great detail, is HIPAA. And this is a key, critical year for HIPAA. And we'll finish up with that, but if you've not gotten started on your HIPAA compliance, now's really the time. So those are the topics that we're going to get to here. Yeah, there she is. That's Patty the alpaca. One weekend, as we were working on our ACA compliance and working with clients, and I had my team in at the firm, it was kind of late in the evening. It was really late in the evening. And we were getting kind of slap happy reading regs. And so we decided we needed a firm mascot. And Patty the alpaca is now our mascot for PPACA. So around our office we have all sorts of stuff for Patty, and she chews on the regs a lot. So. All right, let's talk about the market rules. Again, we've gone over these some in past years, but I want to bring you up to date with where we are because there are some key changes going on. Number one, this is the only rule in the ACA that I know everybody likes. I've never had anybody come up to me and say, I can't believe they did that, how awful. Both sides of the aisle like this rule. It's no pre-ex for anyone. And that means it's not just kids anymore, it's parents, it's older adults. No pre-ex for anyone. Everybody likes that rule. Everybody hated the old pre-ex rule. It's there. One thing that when people say I like it, they don't understand a lot of them is that's an expensive rule. That's a rule that is raising rates. No question about it. And many of the rules we're going to talk about are. But nevertheless, people like that. They hate going to the doctor and finding out, oh, you had pre-ex, and so we're not going to cover it. It's gone. Second rule, no annual limits on essential health benefits, EHB. I'm going to be using a lot of acronyms today. I tried to keep the slides to only 120 pages. But no annual limits on EHB. This means that those things that are listed in the 10 categories under EHB can have no specific annual limits on them. This will impact two types of plan designs that we're going to talk about toward the middle of the morning, and those are skinny plans and reference-based plans. All I'm going to say now is this rule will impact these two types of plans. I've got a lot of foundation to lay before you understand how that's impacted. Next are cost-sharing limits. They're not allowed to exceed the HSA limits, which for this year are 6,600 single, 13,200 family. This rule was delayed for a year. That delay is just about over for non-calendar year plans. But the cost-sharing limits of the plan cannot exceed these dollar amounts for 2015.
Again, I went over all these last year. Here's a rule which really isn't an ACA rule. It came out before the ACA, but it is a rule that the DOL is really focusing on right now. Every audit that we've had in process the past year or two of our clients that are undergoing a DOL audit, they are digging in to find out if plans are complying. It's MAPIA, Mental Health Parity and Addiction Equity Act. It requires parity between the medical benefits and the mental health benefits. Often plans in the past would cover unlimited medical, but they would only cover 30 psych visits or 30 counseling sessions or a limit on days in the hospital. And MAPIA says if you don't put a limit on the days on a hospital for a surgery, you can't put limit on days in the hospital for mental health. It requires complete parity. I will tell you, we just completed one audit. It was a client of mine that is uber compliance oriented. I mean, I thought this was going to be the audit that was the easiest audit I'd ever done. We spent about 10 months working with the auditor on MAPIA issues. And it got down to something so specific as our autism coverages, which had been based upon an age range. And it was very gruesome to go through it. They probably spent more on the audit defending their plan provisions than they paid in claims under those plan provisions. In terms of time, too, is a massive undertaking. So if you haven't looked at your mental health benefits, you need to make sure you do so. Clinical trial coverage. This is another very expensive rule. In the past, a lot of plans excluded clinical trials and experimental procedures. They would only cover procedures that were fully and finally approved by the FDA. And that's a long process for that. The ACA says you have to cover all phases of a clinical trial. Again, plans originally only covered full and final approval. Some might cover phase 3, some covered phase 4, a few covered phase 3, no one covered phases 2 or 1. After the ACA, you have to cover all the way down to phase 1 if certain conditions exist. The big deal here is that you're paying for something that may not work. It's a clinical trial. That's what clinical trial means. We don't know if this is going to work or not. You have to pay for the treatment. You do not have to pay for the research. The research has to be borne by the university or whomever is doing the research. That's what my son does. He's a student at Stanford Medical School in the research program. So we've often talked about this, is how do you determine what is the treatment component and what is the actual study and testing part of the coverage. Again, it's something you really want to pay attention to because often you may have insureds who get pulled into something, and again, we don't know if it's going to work or not. And in some cases, you may be paying a lot of money, and what they're getting in a double-blind study is sugar pills. So you may have a $50,000 claim, and they got 10 cents worth of sugar pills. Would have been just as well off buying a bag of Skittles. Okay? But you're paying for it. So that's clinical trial coverage. It's actually a very, very big item right now. Waiting periods. There are new maximum waiting period rules, and the maximum waiting period is 90 days. That waiting period means that coverage must begin on the 91st day. Many plans before this rule would say you are eligible for coverage on the first day of the month following 90 days of employment. So if you're hired on January 15th, then you've got February, March, April, you would be eligible for coverage on May 1. Under this rule, you cannot be eligible for coverage any later than April 15th. It's 90 days of employment, not the first day of the month following 90 days. And that's gotten a lot of people upset. There is a new transition rule for a 30-day orientation period. The full effect of this rule has not yet been worked out. We're looking at that. We will talk more about the 30-day rule when we get to pay or play, because it really ties in with that. You're going to see a lot of rules that overlap between these market rules and the pay or play rules. The other thing about the waiting period limitation is be really careful if you're an employer that has a lot of layoffs and rehires and all that, because if you've got rehired employees, you really need to pay attention to how this 90-day rule affects your rehired employees. Rehired employees create so many benefits issues. They create issues under the 90-day rule. They create issues under pay or play. They create issues under the pension plan, all that. There is only one way to avoid those rules. Only one way. Never, ever, ever rehire an employee. Otherwise, anytime you do a rehire, and I know we've got a lot of people in the room that this is how their corporate life is. When you do a rehire, you have to look at the benefits issues. As we've worked on audits, as we've brought in new clients, and when we get a new client, we tend to kind of do an overview audit to see, are you basically doing stuff the way you're supposed to do before we tweak it? One of the areas where we consistently see mishandling deals with rehired employees. So look at that carefully. All right. Next, we have auto-enrollment for large employers. Anytime in a talk that I bring up small employer, large employer, and we've got a couple of new terms that I'll get to later, everybody always say, somebody will raise their hand and say, well, what's the definition of a small employer? There are 4 different definitions of a small employer in PPACA. 4 different definitions of where a small versus large employer lies under the ACA. For this rule, a large employer has more than 200 employees. There are only 2 rules that use the 200 rule, and we'll get to the other one later. There are a number of rules that tag it at 100. There are a number of rules that tag it at 50. And finally, there's one rule, I think there's only one rule that tags it at 25. Same term, small employer, 4 different definitions. At one of the seminars I did, and I was pretty well into the morning by the time I got to this, a woman raised her hand and said, who wrote this? I mean, 4 different definitions, excuse me, for the same term? Well, the problem is not who wrote it, but how many wrote it. The ACA was not written by one person. The ACA started in the White House, and then it went to Congress. And once it got in Congress, on both sides of the legislatures, Congress and the Senate, each of them divided up into committees different parts of the bill. So each committee, some from the House, some from the Senate, had some impact on the rules there, and they used the terms that they were used to. So what happened was the HEW, Health, Education, and Welfare, might have worked on one set of rules, whereas financial organizations might have had impact on another set of rules, and different committees worked, and no one at the end came in and said, we need to tidy up these definitions. So inside the ACA, you can have a single term that will have multiple definitions. You're going to see a couple later of definitions that make no sense in the world. And so it makes it very challenging. There is no one set rule for the distinction between a small and large employer. For most of the rules, it's either 50 or 100, particularly under pay or play. Here, it's over 200. Another distinction in this rule is that this is a rule under FLSA provisions rather than PHSA provisions, which means that this rule applies to all employers, not just employers subject to the ACA rules. So auto-enrollment means that once that employee meets eligibility, they're on the plan unless they opt out. It's kind of like a negative enrollment or an automatic enrollment under a 401k plan. That's where the idea came from. They are on the plan unless they opt out. This rule was supposed to go into effect, we think, in 2010. after guidance would be received. The DOL has yet to issue guidance, so this rule is not yet effective. In 14, they told us, we're working on it, but it won't be this year. They've not given us any signal this year as to whether we should expect those regs this year. So it's not in effect yet, but it's something you should be looking at because I think it will be coming into effect pretty soon. I will tell you, we've had a rush of regs here the past 6 weeks or so, and so there's a lot of stuff coming out on rules that we hadn't really seen much yet, so you might be aware of that. So basically the deal is going to be everybody's on the plan unless they actually sign a form and opt out. For those of you who are in HR, and there are a lot of you, what that means is the first pay period after this rule goes into effect, you're going to have employees come in saying, why is my check $500 thinner this month than it was last month? The reason is you didn't opt out and you just got on the plan whether you wanted to be on the plan or not. And then they yell at you. And then you say, it's not my fault, call Congress. But that rule will be a big deal once it comes into play. There are a number of fees that are brought about under the ACA. There's an annual fee on health insurers. This applies to fully insured plans, not to self-funded plans. It applies to carriers. Not self-funded plans. It does apply to self-funded MIWAs, multiple employer welfare arrangements. The fee this year, and it's a really weird fee, it's difficult to determine how much each carrier is going to have to pay, but the regulators determined that the amount would be $11.3 billion, and then it's going to look at every carrier in the country and what their proportionate share of the total pool is, and they will apportion that pro rata among all the carriers in the country. So this is one of the rules which impacts higher costs on fully insured plans. Okay? Now, one of the things, and I've talked about it with you all before, one of the things that we are definitely seeing now, and I'll talk about it more in the second half of our program, is that there is a migration to self-funding. That some employers who prior to the ACA said, I really don't want to take that risk on, are now looking at a lot of the cost factors under fully insured and saying, you know, it may be the year we need to take a look at that. You think, oh, you don't want to do that because this will cause great upheaval, we'll have a different plan, different carrier, different network and all that. You can still usually work with your same carrier to transition from fully insured and self-funded if you're at that level. Now, you still want to be at a level where you can absorb the risk. So that's something you want to look at. But I'll be getting into a number of these rules that affect only fully insured plan, not self-funded plans. The next one is called PCOR. This is patient-centered outcome research fees. It's looking at what treatments available are actually effective. So for any condition, diabetes, cystic fibrosis, obstructive failure, any medical condition, they're saying what things are being tried, what work, what don't work. And the idea is at some point the regulators are going to say, for diabetes, we'll cover these things but not these things. This is one of the rules that's been lumped under that political term of death panel. That we're not going to cover this, and so you just may die. Whether you like that analogy or not, PCOR is in there, a couple of other things are in there. But PCOR is trying to create efficiencies in terms of what plans are paying for. Next, we have rating. This is called Fair Health Insurance Premium. Some call it adjusted, most of us call it adjusted community rating, which is not a new term at all. Most states have some form of adjusted community rating. In the past, carriers used all sorts of rating criteria to determine what your premium would be. Dozens of different criteria. For FHIP or ACR, which applies to a small group market, carriers can only use 4 factors now. age, area, geographic area, status means family status, and tobacco usage. Area means the cost of care in Springfield is different from Kansas City, where I live. It's different from Texas. It's very different from New York. Okay? So that affects rates. With this, what happens is this huge spread in rates is compacted because a lot of the different rating tools can no longer be used. So this is what I call a compression rule. A compression rule. It's compressing rates. Okay? The age bands are under 21, 21 to 63, and 64 and older. That makes a lot of sense because we all know a 22-year-old and a 62-year-old have just about the same health. So under ACR, it really does ratchet down the rating options in the small group market. One of the other things the ACA is trying to do is open up the market. Open up the market quite a bit. There are 3 rules here. I taught this one pretty detailed last year. It's guaranteed availability, meaning that if a carrier offers a product in the small group market to any employer, it has to market that product to every employer in the small group market. It can't say, if we've got 2 employers here, this employer and that employer, it can't say, you guys are pretty healthy and cool. We're going to offer this plan to you. Not y'all. No. We saw how many donuts you had. We're not going to offer this product to y'all. So guaranteed availability said if we offer it to this employer, we have to offer it to this employer too. Guaranteed renewability means once you have that plan, the carrier has to renew it. They can't say, boy, you guys really had a terrible year and we don't want you anymore. That's guaranteed renewability. And then single risk pool rule means that when carriers take small employer risk, they have to consider that one single risk pool. They can't say, you know what, we will keep our companies that have good risk factors, and we'll cover those outside the exchange. But the unhealthy ones we'll put into the exchange. Single risk pool means they have to put into one risk pool their employers inside and outside the exchange. It's a huge rule. What that means is, no matter if you're in the exchange or not, your rates will be impacted by the exchange because that risk is being lumped in with your risk. One of the things that I often say in my seminar, of all these market rules, and we've gone through a bunch of them, we got a few more to go, they can be brought down to 3 key words. Okay? Access, number 1. There are rules that deal with access. This is an access rule. Number 2, compression. Taking this much of a spread in rates and compressing it down to this much of a spread. Compressing the premium differentials. And then the 3rd is uniformity. That's like the essential health benefit rule. Every plan has to cover all these EHBs. So that's how way when an individual is deciding, do I want this plan, or this plan, it's easier to make a decision because the coverages are just about the same. They all meet the same essential health benefits. So, uniformity, access, and compression. All these rules I'm going over fit into one of those 3 categories: uniformity, access, or compression. Spreading the risk. This is more of a compression rule. We have the 3 R rules that I call them, the 3 R's. They are reinsurance, risk corridors, and risk adjustments. These rules are different in how they solve a problem, but they're all there to solve the same problem. Okay? You might think of these as the Robin Hood rules, because these rules take from the rich and give to the poor. What they're doing is they recognize that there are some carriers because of their name, that have historically been able to be selective about who they covered. Because everybody wants to be a part of them. Because of the name they have in the national market, people feel good about having that brand. They're on the back row back there. Okay? People feel good about having an ID card with one of those names on it. But then there are these other carriers out there that are second and third or fourth tier carriers who really don't get that select block of business. And they may have specialized in taking groups that other carriers didn't want. Well, what these rules do is say, those folks on the back row, we're going to take some money from you in a number of different ways, and we're going to give it to those second, third, and fourth tier carriers because they're covering blocks of business that you may not want to. I got invited in 2010, one of the most interesting seminars I ever did. I got invited out to Wall Street and spoke to about a dozen investment management firms. And the question they had for me was, how many carriers will still be around in 2015, 5 years from now? They all thought that by 2015, this country would probably be down to 4 carriers. They said, you know, these rules are just so complex that it's going to take such a monumental task to be compliant. Smaller carriers just aren't going to be able to do it. And I told them something that they didn't expect. I said, I completely disagree. Because there are provisions in here where the large carriers have to give them money to help them stay afloat. And I talked a lot about these rules, GA, the 3 R's, and all that. And I said, and then there's another piece, which is these carriers are likely going to want to sell products on the exchange, and they're not going to have an advertising budget because the government's paying for the advertising, which allows them to put more money into the actual claims and products. It's been very interesting. We've seen a few carriers go under. We've seen some consolidation, but we have not seen the massive exit from the market that a lot of people expected. They were a lot of really smart people. I'm just glad that my prediction was right. If it hadn't been, they might have wanted their money back. I don't know. It was a very interesting day, though. These rules operate in different ways, but again, they are there to assist carriers that are willing to take on risks that the market hadn't done for some period of time. But they just do it very differently. Okay. This next one's a biggie. It will be a biggie. Under current rules, we have something known as 105H. That's in the Internal Revenue Code. And for self-funded plans, it says self-funded plans must meet these non-discrimination rules. If you have an employer in one of the historically, and I'll go ahead and show you what these are, targeted industries. Industries, and I know we've got a bunch of these in the room. Forgive me, it's not my thinking, it's someone else's. But these are the targeted industries that historically have had discriminatory plans. Restaurants. Restaurants offer different benefits for management as they do for line help, dishwashers, cashiers, and all that. Retail, hospitality, workforce. These are carriers that historically, even though they are very large, they've had fully insured plans instead of self-funded plans. They are huge, and they certainly have the ability to self-fund, but they haven't because under self-funding, they couldn't meet 105H. There was no similar set of rules for fully insured plans, and so I'd say, well, we can then be discriminatory with a fully insured plan, whereas we couldn't if the plan was self-funded. This was part of the ACA. The ACA specifically said this rule would go into effect in 2010. IRS said, not until we issue guidance. It's 5 years later, we still have no guidance. And I was just at this Portland conference and talking to a bunch of my EBIA buddies. I said, has anybody heard anything about whether we're going to get this guidance this year. Not a word. So we don't know if we'll get it this year or not. But beware when it does come that the penalties are going to be pretty strong. It will be an excise tax of $100 per day per non-highly compensated individual. So if you violate these non-discrimination rules, that's a penalty of $36,000 per employee. That's huge. Okay? $36,000 per year per employee. If you've got 10 employees, that's a penalty of $360,000. Okay? So when these come, I know Connell will be getting the word out immediately. We assist in getting some of the information out to you all through the alerts and everything. This will be a biggie, and it's going to create a lot of need for changing certain plan structures. But we'll get the word out pretty quick. We don't know what those regs are going to say. I will just say for now, be aware that those regs are very likely going to have an impact on your pay-or-play compliance programs as to whether your pay-or-play programs are discriminatory or not. Another deal has been wondering how this will work, because if you've got fully insured plans and you've got factories in 5 different states, each of those states is going to have a different set of base plans under EHB. So how can you comply with non-discrimination if in each different state you're required to have a different plan of benefits? And what if you have some plans that are self-funded and some plans are fully insured? These are some of the issues that the IRS is struggling with. These are some of the issues that are the reason why we still don't have any rules. Okay? SBC, I've talked about this with you all a lot in the past year or two. This is a rule that says that your plan document is too long. That really offends me because I write these plan documents. I feel like they're attacking me personally, and why don't they like a 120-page document? So they're saying, well, no matter what your plan is, you have to boil it down into 4 pages. They then defined a page as to be a sheet of paper because they couldn't fit it all on 4 pages, so they said a front and a back equal 1 page. So the 4-page SBC became what I would call an 8-page SBC. But they issued regs, and then they just came out with a new set of regs in December that is proposed. They'll become finalized by 1/1/16. They'll be effective 1/1/17, and they are actually going to change your SBCs. So we'll keep you up to date on that when it happens. The new regs are trying to streamline it a little bit. The new regs also make clear that they apply whether it's a paper or electronic transaction. Reporting. There are other reports that have to go on: quality of care reporting, transparency and coverage reporting, and reporting upon the number and aspects of self-funded plans. That report just came out about 10 days ago. It's been very interesting. When Congress wrote this provision, they said that they thought self-funded plans probably denied more claims than fully insured plans. And that's really what they were looking at. So if you read this report, that's the kind of things they go into. Are employers self-funding because they want to be more stingy in benefits and more stingy in claims payments? We don't see that with our clients. Now, it may just be who our clients are, but we're not seeing we see people self-funding for other financial reasons, but not to scrimp on benefits. The next topic, I got to be honest, I don't really know what to tell you. It's Cadillac plan tax. In 2010, I made a firm prediction. We would never see the Cadillac plan tax. Neither side of the aisle likes it. Both Republicans and Democrats dislike it. The two groups which would most be affected by a Cadillac plan tax would be highly compensated employees and union members. Does that tell you why neither side of the aisle is going to like it right there? They've each got somebody who's going to be affected by it. It's supposed to kick in 2018. For 5 years, I've been saying, don't worry about this. It will never happen. And I've been saying, and we haven't seen any regs, which is just further assurance that we'll never see the Cadillac plan tax. 3 weeks ago, a month ago, we got our first set of regs on the Cadillac plan tax. So last week when I was teaching in Portland, where I had told these folks, don't worry, it'll never happen, I said, guys, I think I need to eat my words here. I said we'd never see it. We just got these regs. It's looking like they're getting real serious about it. So maybe my prediction was wrong, and we will see the Cadillac plan tax. Well, this week, there has been legislation proposed with a long list of sponsors to abolish the Cadillac plan tax. It's been introduced. It hasn't been voted on yet. It has the support of the leadership on both sides of the aisle in both House and Senate. So there's a really good chance that it will pass. We don't know about the White House yet, whether they'll veto it if it passes. So I'm starting to sound like a politician, but I'm going to flip-flop again because I think there's still a good chance that we'll never see the Cadillac plan tax. My real theory is that they may not get sorted out this year, and just like a bunch of the other ACA rules, they'll delay it, maybe delay it again, and then maybe at some time just abolish it. For now, it's there. I've actually started covering it a little bit because it's looking like it'll be here. The excise tax will apply to plans that have a value of more than the amounts listed on that chart there. Okay, I'm not going to go to it in much more detail. By seeing how many people sponsored this bill, I still think some way or another, as some part of some bill or another bill, I still think the tax is going to go away. Okay, let's look at my second big piece of information here. This one's going to get real detailed, guys. It's new cafeteria plan rules and premium payment arrangements. Forever, we have seen a strategy, long before the ACA, that employer will say, I don't want to set up an employer plan. I don't want a group health plan. I'm a small employer. I don't have the time to deal with compliance. I'm not going to set up a group health plan. I don't want to be subject to ERISA. I don't want to file 5500s. I don't want to have to deal with the carrier on behalf of everybody. So here's the deal to my 8 employees. Go out and buy your own insurance and we'll reimburse it. We'll reimburse your individual insurance premium. Some employers would do it directly. Most of them would try and do it through their cafeteria plan or their FSA or their premium-only plan. So they're saying, don't want to deal with ERISA, don't want to deal with the IRS. Y'all go get your premium or go get your coverage, and we'll reimburse some or all of that premium. IRS has always hated that strategy. Strategy simply doesn't work for a lot of reasons. But they kept doing it. And the IRS kept coming out with guidance saying, you can't do that. I teach at one session every summer up in Seattle. It's the Advanced Cafeteria Plans Conference. Every year that I've been teaching at that thing for 10 or 15 years now, this issue comes up every year. And they keep doing it. And now it's actually even increased after the ACA. So what we had happen was the IRS issued, first off, Notice 2013-54. And it says a cafeteria plan cannot pay or reimburse individual premiums, whether or not purchased through an exchange. And what had changed since the ACA is employers would say, go buy your individual coverage now on the exchange, and I'll reimburse it. 2013-54 says you cannot do that. I put the little note there, psst, services never liked this strategy. That's an understatement. They hate this strategy. The rules also say a group health plan cannot be integrated with an individual policy to try and satisfy the ACA rules. And that a payment or reimbursement of those premiums violates the ACA's preventive service mandate and annual dollar limit prohibition, primarily because most of those individual policies do not meet the requirements for a group policy. Okay, this is getting pretty detailed again, guys. The excise tax, once again, is $36,500 or $100 per day. So this is Notice 2013-54. Okay, it's really clear. It's really obvious. They've told us completely what they want. That ended the question, right? No, they actually had a lot of rules saying FSA is an accepted benefit, not subject to the market rules we've been talking about. It talks about an HRA can be integrated or non-integrated, and we'll talk about that more later on. It gets into how these rules affect cafeteria plans, HSAs, HRAs, and other premium reimbursement types of programs. One of the things it did, it left open a very good planning option of an integrated HRA. If you're really looking for some way, and maybe you've had an HSA, can't do with it what you wanted to be able to do or what you're able to do in the past, talk to Tom or one of the other guys at Connell about the options of an integrated HRA. Very complex. I won't go into all the details today, but they are an excellent tool right now to bring down the cost of the premiums under the insured coverage and, in essence, self-fund a little bit of that in-house through an integrated HRA. What's left after 2013-54? EAPs are still good because they're not subject to this guidance. Integrated HRAs, talked about that. Limited HRAs for dental and vision and retiree only are still good. Standalone HRA can actually keep somebody from getting a subsidy on the exchange. And then despite all this, despite the really clear guidance, in 2013-54, when this came out, a lot of these providers in the market of FSAs, HRAs, HSAs started looking for loopholes. And I started getting clients like Tom and others around the country that are good, strong, compliance-oriented brokers saying, okay, I know it shut it down, but look what I just saw. There are a couple of vendors out there. I won't give their names in this open session because I don't want to be accused of slander. But as soon as these rules came out, they said, we've got a way around it. We hired some really smart people, and we figured out a way around these rules. So 2013-54 came out. We thought, finally, we're going to get rid of these bad ideas. Didn't happen. So what do you think the IRS did then? Came out with a new notice. Notice 2015-17 came out in March. And basically what it has done is say, okay, we realize 2013-54 freaked out the market. And some people are still trying to sell these things. We're not going to allow that. No selling of new stuff like that. But who's actually doing what's been prohibited? In most instances, it's the smallest employers, because they think we're too small to have a group health plan. So they said, for a non-ALE, and I'm not talking about beer there, by the way, non-applicable large employer means an employer with fewer than 50 people. We're going to delay the excise tax for 1 year, giving these small employers 1 year to get rid of that arrangement. We will not require the excise tax this year. but you have 1 year to get rid of that plan design. And after this year, then we're going to continue and go back and enforce it. So, when it came out, these same vendors are going, yes, they agreed with us. Well, not really. They just realized it's hard to get the word out to small employers. Okay? And they may not be dealing with the same level of broker that you all are dealing with. So they're not getting good advice, and there's this limited relief. It also went into certain other funding vehicles that are out there, including Medicare premium reimbursement arrangements. It says you can reimburse Part B or Part D premium if the employer offers a group health plan, the employee enrolled in Parts A and B, and the employee is enrolled in A and B or D. The reimbursement is limited to Medicare B, Medicare D, and Medigap. So it allows limited Medicare premium reimbursements. Likewise, it allows limited TRICARE, which is military coverage. Same basic rules as for Medicare. It also says that the employer may increase the employee's, keyword, taxable compensation. So the employer can reimburse the premium, but that is a taxable income item. What they've been wanting to do is reimburse that pre-tax or tax-free. So that didn't satisfy anybody. Oh, great, well, they can reimburse it, and I'm going to be taxed on it. Okay? So it's really just getting to the fact that you can't do this technique, which has been done before. Now, that's where we are. There are still employers out there doing it. There's still vendors out there who are promoting it. We've got 1 year to unwind these things and look forward. Be very careful. Now, what I'm anticipating is that the reason you all are here is because you all are employers and providers that are compliance-oriented. And this rule probably doesn't apply to anybody in this room. But also beware, if somebody else is coming to sell you one of these programs, they simply are not holding up looking forward. All right, eligibility issues under your cafeteria plan. We've had some guidance, and I'm going to hit this more later, but pay or play caused problems with cafeteria plans, particularly as we were looking at, and the one issue I'll talk about here. Under pay or play, you've got the measurement period, the administrative period, and what's called the stability period, right? And during that stability period, no matter what their hours are, those employees are locked in to being provided coverage. Now, what may happen is that during the measurement period, they were deemed to be a full-time employee. But once they got into that stability period, which I actually call the coverage period, they're in there, and for that 12-month period, for the first 6 months, or let's call it 7 months, they've been a full-time employee. And so it's made sense that they're working at least the 30 hours, more like 40. They're getting the premium paid on the cafeteria plan. They're taking out their portion of that premium, and everything's going great. But then the employer has a layoff, and they're one of the ones laid off, or their hours are dropped from 40 to 20. But they're in that lock-in period. And they're going, if I was working 40 hours, I can pay my share of that premium. I can afford it. But now I'm working 15 or 20 hours, and that's taking my whole paycheck. It's not working for me. What this new rule says is it allows that employee to make a change under their cafeteria plan. We'll talk about the outside plan later. But it allows them to make an election change to get some relief in this scenario. That regardless of what the 125 rules say, a change in status can take place, and they can get that taken out of their payroll withholding. It's an important new eligibility rule. So it's Notice 2014-55. A full-time employee reasonably expected to work more than 30 hours is reduced where they'll reasonably be expected to work less than 30 hours, even if it doesn't necessarily result in a loss of eligibility. The employee can revoke the election in the group health plan and enroll another plan providing minimum essential coverage by the first day of the second month. So what that's saying is they can't just say, I can't afford it, I'm going off the plan. They can say, I can't afford to be in my employer plan anymore, and now that I'm only working 15 hours instead of 40, I can go to the exchange and get a subsidy and pick up an MEC on the exchange and then drop out of the employer plan. So they can only drop out if they go get some minimum central coverage elsewhere. It could be they get on the exchange. They might get it through some other mechanism, like through their spouse's employer or whatever. So that's 2014-55. Sorry, guys, I told you. This is going to get detailed. Tom warned you too. So this may mean you need to get stronger coffee at the break. Second change. You can have a special enrollment period, eligible for special open enrollment period in the marketplace. They can enroll in the group health plan and enroll in a qualified health plan by the first day immediately of the month, immediately follow the loss of coverage. Okay? So anyway, those are to deal with situations where hours change, they can no longer afford your plan. Two other things I want to say about exchange coverage. Can payment of an individual exchange plan be reimbursed through the CAF plan? No. No, no, no. We've got guidance every year for the past 3 years, and all those guidances agree, no. Okay? What if it's shop coverage? Shop coverage is an employer plan. A lot of people don't realize this. Even though the exchange is run by the government, shop plans are ERISA plans, not governmental plans. So shop plans are governed by ERISA the same as your group health plan is now. And because of that, FSAs can reimburse premiums under shop coverage. Shop is small employer exchange coverage. FSAs can reimburse shop coverage. Shop coverage has to file 5500s and do all those other things, but the big item is it can be reimbursed. All right, a few other things on cafeteria plans. First off, FSA carryovers. I'm involved with a group, and if you're one of the larger employers in the room, you don't know about this group yet, you might want to look at it, particularly if you have a elaborate cafeteria plan. It's called ECFC, which is Employers Council on Flexible Compensation. It does a lot of lobbying on behalf of various types of cafeteria plans, HSAs, HRAs, and such. ECFC hates the use it or lose it rule. Most employees hate the use it or lose it rule. We got one modification this year, and that is modifying the use it or lose it rule, which allows deferral of up to $500 of an unused amount in an FSA at the end of the plan year. And the employee is able to reimburse out of that during the following plan year. So instead of looking at, it's December 15th, I've got $475 left that I didn't use because, doggone it, I was healthy this year. Now I've got to find some way to pay for it. I have really lousy vision. And so I have glasses that are uber expensive, and I'm always getting them adjusted just because I'm over there a lot because of the type of vision I have. They have to be adjusted a lot. And I enjoy talking with the person who always adjusts my glasses for me. And she always tells me, I hate December. Because everybody's coming in December and they haven't figured out any way else to spend their remaining money in their FSA, so by golly, I'm going to buy a new pair of prescription glasses or prescription sunglasses. And she said, man, December's just our craziest month. And so instead of buying a pair of glasses they don't need, they can actually hold on to this money and push it over to the following year. It's a very good rule. It's a rule that ECFC worked on. It does not count against the $2,500 limitation on the amount that can go into the HSA. It does not offset that amount, so they can still get the $2,500. The one thing you have to look at is you can't do both this and the grace period. You cannot combine the unused rule with the grace period rule. You can't cash it out. It has to be used for actual benefits. And then if they do carry it over and the employment's terminated, they forfeit that money as a result of termination of employment. If you want to adopt this rule, you need to amend your plan. Now, we have a lot of employers who have done this, and it's a good rule. Again, ECFC pushed for it. If you're kind of deciding, maybe, well, we've got a grace period, or we're thinking about a grace period, which makes more sense for us? The advantage of the carryover is that the money is available for the entire plan year, not just for 2.5 months. Under a grace period, it's only there for a shorter period of time, but the advantage of grace period, it applies to all unused funds. It's not limited to $500. And if you've got an HSA, you might want to use the grace period instead. But it's a new rule with lots of good new opportunities. I will tell you, ECFC is lobbying on a number of issues right now. One of the issues they're lobbying very hard on is with respect to how HSAs and HRAs and similar vehicles apply to the Cadillac plan tax. So, if you have a CAF plan, you have several amendments that need to take place. You need to amend for the $2,500 limit, which is up to $2,550 this year. If you have an FSA carryover, you need to put that in your amendments. And the other thing I would just say in general, if you haven't updated your cafeteria plan in the last 2 or 3 years, it needs it. There have just been a number of changes, and you really ought to look at updating the plan. So I imagine a good percentage of the employers in this room have a CAF plan, so consider that. Okay? All right. Here it is. Take a deep breath. Exhale. Think some happy thoughts for the next 30 seconds. Happy thoughts, happy thoughts. Don't think about pay or play, because now we got to get into pay or play. Again, what I am going to do today is go over the key changes for this year. I'm not going to go over the complete rules. I've done it in years past. In talking with Tom, I said, hey, buddy, I can do pay or play, or I can do everything else. And we thought it was good to hit these other topics today. Okay? Have you had your happy thoughts? You're about to hear some unhappy thoughts. Let's talk about pay or play. The biggest issue under pay or play is what's going to happen in the Supreme Court. They heard this case several weeks ago. I am such a nerd, I listened to the entire oral arguments. One is, I am actually a lawyer. I never go to court. I am not a litigator, and I don't want to be. I have one of my associates is Belinda Aguilar, who is a tremendous associate. When she joined my firm, she had previously actually been a litigator, and she says she is now a born-again benefits lawyer, no longer a litigator. But the oral arguments were fascinating. There is much going on in D.C. with respect to pay or play. The issue in King versus Burwell is whether the subsidies can be used in states that are operating a federal exchange instead of a state exchange. If you look at the ACA, throughout the ACA, it talks about the subsidies with respect to exchanges. under one of the tax rules, there is this extra phrase saying the credits will be available in a state which operates an exchange. That's the whole King versus Burwell case. I will tell you, just because we have looked at this, we've analyzed it, we've had a number of clients who are very concerned about the outcome. There are many places where it talks about the subsidies being available for everybody. But there's one place that limits it to the state. So those who don't want, or let me back up. Those who say, I hate Obamacare and I want it repealed, use this language to take the Supreme Court trying to do away with the subsidies, because the subsidy is a bedrock on which these exchanges are built, on which a lot of the Affordable Care Act is built, and if that bedrock goes away, a big chunk of the ACA fails. So, there were a lot of governors and others who were highly involved in bringing this case to the court. Now, I always say I'm not going to get into my personal politics, and I'm not. But this is a very political issue, and let me explain why, if you're reading the coverage about this issue, you may start hearing things from somebody that are the opposite you would expect them to say. What's going on right now is a number of the Republican governors around the country are now saying, wait a minute, we don't want the Supreme Court to knock out these subsidies. Because if an individual can only get the subsidy if the state runs an exchange, and the Supreme Court upholds that, and I've got 1 million people in my state who are getting a subsidy, they aren't going to vote for me if I was the one that got that subsidy kicked out. And when they looked at the states that have the highest dollar amounts of subsidies, the top 8 states are Republican states. Number 1 is Florida. I can't remember 2 and 3, Tom. Is Texas, Florida, Texas. Can't remember 3rd. Ohio? Maybe. Anyway, so they're all saying, wait, these people are going to be mad at me, so I'm going to have 2 choices. 1, to have 1 million people in the state of Florida mad at me, or 2, I'm going to have to set up a state exchange so that they can still get the subsidies. And that's something I've campaigned against ever since 2010, and I'm going to have to flip-flop. So there's been backroom pressure from a lot of the Republican governors saying, can you guys start making a little dumber arguments so we'll lose? Or can you kind of back off the rhetoric here? It's just fascinating. It's absolutely fascinating. So the hearing was held. We cannot tell from the hearing for sure which way that's going to come out. I've seen most articles that I've read seem to think it will be upheld. I heard some pretty negative stuff coming from a couple of the justices, so I'm not as certain about that. The other thing that's going on is Medicaid expansion. A number of states are trying not to do that, for example, Missouri. But there's also pressure to do that because it's keeping a number of people away from subsidies. When are we going to find out about King versus Burwell? In June. It will probably be one of the last opinions released. One other thing very interesting about King versus Burwell. They had 4 plaintiffs in the original case. And these were people, not governors, not states. But what they found a couple of weeks before the case was there's something in litigation called standing. You can only be in court if you have standing. And as it turned out, it looks like none of the 4 actually had standing. 2 of them were on TRICARE, and if you're on TRICARE, you can't get a subsidy anyway. One of them was over the financial rules, and the other was the case was filed in Virginia, and one of them lied about her address. She used a hotel room as her permanent address. She didn't live in Virginia. So if you listen to the argument, you'll hear Ginsburg come in and say, don't we have a standing issue here? And both sides said, well, we're going to assume they're standing. If the Supreme Court wants the easy way out, they'll just say, you know what, we looked into this and none of the four have standing. What would happen then? Somebody else would have to file a new suit on the same argument. It would take 3 years to get to the court, and by that time the subsidies would be so ingrained nobody could possibly get them knocked out. It'll just be very interesting to see what happens. Belinda in my office, a former litigator, loved listening to it. But yeah, I listened in on it. It was interesting. All right, let me talk about delays and relief. As I was thinking about last year and this year, when we got to January, I said to my staff, you know, as hard as last year was, this year's going to be worse. Fourth quarter is going to be awful. Third quarter is going to be rough. Because last year, pay or play kicked in for those with over 100 employees, and this year, it's going to be those in the 50 to 99 space. And they are much less prepared for pay or play than those over 100. Frankly, last year, by the time we got to October, we were pretty well done with most of the pay or play. There were a couple of unusual employers that didn't realize that would apply to a big sector of their population. There were some of those, and we're like, okay, we'll deal with those, but it wasn't that bad. I've told my team, fourth quarter this year, I'll tell everybody at Connell, put on your Teflon suits, man. It's going to be a rough time period because there are a lot of employers that are going to be affected. So what are the delays? It was delayed for all employers till 2015. It's been delayed for smaller employers until 2016. Okay, let's talk a minute about the English language. If I have one thing that's small and something that's smaller, which is larger, the thing that's small or the thing that's smaller? Small is bigger than smaller, right? Small, smaller, smallest, right? So small is the biggest, smaller's in between, smallest is the smallest, right? That just makes sense, right? Well, Congress said in these new pay or play rules, a small employer has less than 50. A smaller employer has 50 to 99. I had to read that thing 3 times just to say, did they really say that? So we have a small employer, a smaller employer, and a large employer. And I'm thinking, have they ever been shopping for a shirt? Do shirts come small, smaller, large, extra large? Have they ever heard of the word medium? Okay? But a smaller employer is larger than a small employer. Okay? A smaller employer is in that 50 to 99 range. For smaller employers, pay or play kicks in 2016. That is the group which I believe is not ready for pay or play around the market. Those of you in the room in that size, congratulations, you're way ahead of your peers out there. Okay? So that's the number one thing, and that's why the end of this year is going to be very rugged. It's going to be very rugged. There's other transitional relief that we're going to get to. There's some delayed information reporting. And are we going to see more delays on pay or play? I don't think so. Maybe on specific rules, but for that smaller group, I don't think we're going to see further delay because, for one thing, 2016 will be Obama's last full year in office, and he's going to try to get as much of this stuff wrapped up as he can while he's still in office. So I don't expect further major delays on this piece. So what is a smaller employer? They have no penalties for 2015 plan year if They have between 50 and 99 full-time employees and full-time equivalents. Here's the key piece. And I'm going to show you several delay rules which have this same piece, which is, we're going to give you relief, but you have to play fair too. Okay? You have to be a good citizen. We'll give you relief that you don't have to comply with pay or play this year, but you cannot reduce the workforce or the overall hours of your workforce between 2/9/14 and 12/31/14, unless it's for a business activity unrelated to the relief, and your health care coverage cannot be materially reduced or eliminated after 2/9/14. Okay? It's saying, we'll give you this relief, but you have to play fair. What's the importance of that date, 2/9/14? That's the day that the guidance came out on this relief. So what they're trying to avoid is an employer saying, I've got 103. So if I get rid of 4 employees on March 1, I can postpone pay or play for a year. If they do that after 2/9/14, it's too late. So basically it's saying, we issued this guidance today. You can't change anything in your plan as of today. Today being 2/9/14. You can get the relief, but you have to play fair. Okay? Do you get that? Is everybody with me on that? It's a really big deal. Okay? 2 most important dates right now under the ACA are March of 2013 and now February of 2010. March of 2010 and now February of 2014. Okay? Reason I want to make sure you're with me is this rule in different permutations is going to come up more than once. Okay? Eligibility transition relief says there are no penalties prior to the first full day of the 2015 plan year for any employee whenever hired who is eligible for coverage on the first day of the 2015 plan year under the terms in effect on what day? 2/9/14, that same day. And they're offered affordable minimum value coverage as of the first day of 2015 plan year. So this is a rule that says it's kind of as long as you're working toward it for 15, you're okay. And it says they're not eligible for coverage under a calendar year plan of the employer as of 2/9/14. Okay? So this is saying if there is an offer of coverage, then you can avoid the A penalty. This does not, or the B penalty, this does not avoid the A penalty. There's another rule called the significant percentage transition relief. Okay? And it works like this. It says, if an employer covers at least 1/4 of all, there's another rule coming up next, which is different. So circle the word all, because that's the key piece here. They cover at least 1/4 of all employees as of any date between 2/10/13 through 2/9/14. There's that date again, right? So it's coming out of the same notice. Or they offered coverage to 1/3 or more of all employees during the open enrollment period ending before 2/9/14. There are no penalties for any full-time employee. Offered affordable minimum value coverage as of the first day of the 2015 plan year. Are not eligible for coverage under a plan year of the employer as of 2/9/14. This rule is there, and it will have a dramatic impact on employers with a large part-time population. So this can be a problematic rule for employers, let's say in the restaurant industry. We have a large part-time population, or workforce, hospitality, some of those different groups. The reason for that is here the percentages are of all employees, meaning all full-time and part-time employees. Okay? Now, we have a similar rule, but here I want you to circle all full-time. This rule only applies to your full-time, and it says the employer must cover at least a third, as opposed to a quarter, in the prior rule, of all full-time employees as of any date between 2/10/13 and 2/9/14, again, that same date, or they offered coverage to a half or more, and in the prior rule it was a third, of all full-time employees during the open enrollment period ending before 2/9/14. And there are no penalties for any full-time employee offered affordable minimum value coverage as of the first day of the 2015 plan year and not eligible for coverage under the calendar year plan of the employer as of 2/9/14. Once again, both of these rules under the significant percentage rules allow some relief, but you still have to play fair. Okay? You can't jack up your rules anytime after 2/9/14. So this rule helps more for employers that do have a lot of part-time employees. If you've got a lot of part-time employees, you want to use this rule instead of the preceding rule. Next, we have offered dependence relief. Applies only for the 2014 plan year. If there is a penalty solely for not offering dependent coverage, then there is a transition in the penalty. As long as they take steps in 2014 or 2015 to offer that coverage. So if the penalty is solely for not offering to dependents, so maybe the employer is offering it to employees, but not dependents, then we've got a relief period here. This relief does not apply if the employer previously had dependent coverage and dropped that coverage. Again, you have to play fair. Right? You with me? Sorry, this is tough stuff, guys, particularly since we didn't do the backup into it. Another one. These previous three rules applied to limited sectors. This rule applies to everybody in terms of relief. Last year when I came in, I said you count all the number of your employees and then you have a reduction of 30. So if you had 100 employees, you would be facing a penalty on 70 of them, because you reduce the number of employees by 30. For 2015, they increased the reduction from 30 to 80. For 2016, it goes back to 30. Okay, with me? Okay, for 2015, it's 80 instead of 30. For 2016, it goes back to 30. For 2015, on the A penalty, which applies if you're not offering coverage to at least 95% of your employees, for 2015, 95 is reduced to 70%. That's a very helpful rule, folks. These are very, very helpful rules for this first year transitioning into pay or play. They are one-year rules. Do I expect to see them extended again? No. They've already delayed pay or play entirely for a year. They're offering a one-year further relief. I don't expect to see those further extended. Okay? So those are our new transition rules. We have some other new rules for this year in terms of categories of employees. We have two new types of employees. We've always had full-time. We've always had variable hour. We now have a new definition of part-time employee. Is somebody who is reasonably expected to be employed for an average of less than 30 hours per week. And we also have a new definition of seasonal employees. that they typically work for a period of 6 months or less during the plan year. Here's another one of those rules where we've got two different definitions of the same word. Seasonal employee, for purposes of this rule, is somebody who works 6 months or less. For purpose of the penalty calculation, it's somebody that works 4 months or less. And both are definitions of a seasonal employee. Kind of frustrating, isn't it? So the term is different for the calculation of large employer status and for the penalty calculation. In terms of identifying full-time employees, we have a fairly new type of measurement which is called monthly measurement, which we also call real-time measurement. If you have variable hour employees, you do not want to use this method because you're putting people on and pulling them off every single period. Okay? We have look-back measurement, and you look back, and then you categorize the employees under various rules. We also have certain types of excluded employees, and we have further definitions here. You can exclude employees that are bona fide volunteers. So if you're a hospital and you have like volunteers working at the welcoming desk or in the gift shop, those do not factor into pay or play. One of those also is firefighters. Something near and dear to our heart because we bought a house in a brand new suburb of Kansas City, and we bought the house. We didn't look to see what fire department we're in, and we got a very wonderful house that we love a lot, and we're in a volunteer fire department. That didn't work out real well for us. Federal work-study exchange students, or work-study students, externs or interns, provided they're not paid, and members of a religious order subject to a vow of poverty. We also have employees with unique hours and special rules. If we have any universities or colleges in here, this relates to adjunct faculty. We have other unique situations such as on-call employees, airline employees, and employees with layover hours, and commission sales employees. All right. We are at break time. I was hoping to finish pay or play before we didn't get there, but we'll get it as soon as we come back.